The chair now recognizes the gentleman from Massachusetts.
Well, thank you, Mr. Chairman. I rise to offer an amendment that would authorize the Secretary of Defense to make existing funds available from the Defense Health Program for collaboration with medical researchers and universities to address the growing number of tick-borne diseases through research and testing. The Army Public Health Center has operated a basic tick testing program for nearly 30 years. Through this program, military personnel can assess tick identification services through military healthcare facilities at no charge. However, the tests provided by this program are limited to only 6 tick-borne diseases, whereas the Center for Disease Control and the Department of Defense have now identified 16 of these tick-borne diseases, some of which can be fatal. According to the Center for Disease Control, around 30,000 cases of Lyme disease are reported each year. However, additional CDC research reveals the actual number of diagnoses could be as high as 300,000. And alarmingly, nearly 20% of the people surveyed in areas with high incidence of Lyme disease were unaware that the disease was even a risk. This issue is a particular concern in my region. According to the Massachusetts Department of Public Health, my district includes the counties with the 5 highest rates of Lyme disease in the Commonwealth, including Barnstable County, home of Joint Base Cape Cod. However, my region is not alone on this issue. Ticks carrying dangerous diseases can be found in all corners of the continental United States, from Massachusetts in the north to Texas in the south, from Pennsylvania in the east to California in the west. Our service members are especially vulnerable as they frequently are exposed to heavily tick-infested areas. For example, Powassan. The Powassan virus is a serious tick-borne illness known to cause encephalitis, meningitis, and even death. Multiple cases of Powassan have already been reported in Massachusetts this year, yet the DoD tick testing program does not even include a test for Powassan in their regimen. Mr. Speaker, I realize there's a concern that amendments to this legislation might lead to a defense health program pushed beyond its capacity. That's not the case here. The military tick testing program already exists. This amendment would necessarily help the Department of Defense modernize the existing program to meet new challenges in the field of tick-borne diseases. Indeed, the DoD's own website informs us that emerging tick-borne diseases are being discovered all the time, and that yearly cases of known tick-borne diseases have been increasing steadily for years. We're fortunate to have experts already working to combat the rise in tick-borne disease. My amendment would facilitate collaboration among these experts and DoD to test more tick samples for more diseases, meet the growing needs of our military, and ultimately lead to better healthcare outcomes. Mr. Chairman, I do want to thank my colleague from Pennsylvania, Mr. Thompson, for joining me as a co-sponsor in this amendment. Pennsylvania is among the states in the Mid-Atlantic region experiencing drastic increases in the incidence of tick-borne illnesses. And the hope is our efforts today on the floor and by the Secretary of Defense in the next fiscal year will help save lives. Also, thank you to Chairman Thornberry for your work on this important legislation as well. And I urge my colleagues to join me in support of this amendment, and I reserve the balance of my time.
The gentleman from Massachusetts reserves. What purpose is the gentleman from Texas take recognition?